Hi, folks. Good morning. I see people are just coming in, so I'll let people kind of get settled and get started. All right, good morning, everyone, and welcome. My name is Chris Sievers, and I'm the Training Program Coordinator at the National Press Club Journalism Institute. Thank you so much for spending your time with us on this Tuesday. A few things to note before we begin our program. We are recording. To create a safe space, we also ask that you disable any third-party AI assistants that may be recording this session. We'll be disabling any that we see in the chat. And we want to remind you that closed captioning is available in the navigation tool at the bottom of your screens. Highlights and a copy of these slides will appear on our website and in our daily newsletter for journalists, which you can subscribe to using the link in the chat. Please let me introduce our wonderful speaker. Tracy Jan is a senior editor for ProPublica's local reporting network. She regularly partners with local news outlets on investigative projects of great significance. Before joining ProPublica, Jan was a deputy health and science editor at the Washington Post, where she led coverage of medical misinformation, public health, and other health accountability stories. Before the Post, Jan was a national political reporter at the Boston Globe, where she was a two-time Livingston Award finalist. Tracy has been gracious enough, to spend her time with us today and will share practical guidance on how to anchor local reporting and national data, policy, and trends without losing nuance, localize national health issues, reporting that centers people, places, and lived experience, and overall, how to translate complex public health topics into clear, engaging stories for broad audiences. Throughout this program, please submit your questions using the Q&A feature in the menu at the bottom of the screen or in the chat here. This feature allows you to ask questions anonymously if you so choose, and approved questions will appear for everyone. We do ask that you remain respectful of others in this group at the time we're sharing this morning. And as we get started, feel free to drop in the chat where you're tuning in from. Again, Tracy, welcome. To start, can you tell us a little bit about ProPublica's local reporting network and your work there?
Hi, thank you for having me. So I am a senior editor at ProPublica. I joined last January and I work exclusively with local newsrooms around the country, 4 to 6 at a time. Everyone works on different topics. They pitch projects to us, and a team of editors and other staff members at ProPublica choose which ones we want to fund. And we fund local reporters for a year to do deep investigative reporting on issues that are important to their community. So I've worked on issues from oil and gas in Oklahoma to criminal justice in New Orleans, education and sexual misconduct in California. And we'll be talking about two of the stories that were local reporting partners last year. One was focusing on Medicaid work requirements in Georgia, and another story was about medical misinformation and vaccine, fake vaccine cards and the medical freedom movement in Utah.
Great, thanks so much. And I know you have a few story examples to share with us today as well. But to start, and I'll kick us off with questions. And again, folks, feel free to jump in here as well as we're talking. But Tracy, what is usually needed to widen the geographic scope of a story?
Yeah, so first let me talk about why it's so important to broaden a local story into the national context. I did this a lot when I was working at the Boston Globe as the education reporter, as well as the national political reporter, and again at the Washington Post when I worked as a national reporter, focusing on local stories, but also making sure we keep the national context. We want to make sure that your readers understand where they fit, how their community fits into the world at large. And right now, it's especially important with healthcare stories to consider the political context. Um, Especially with healthcare stories. I started covering healthcare as a national political reporter right after Obamacare passed. And that issue has always been politicized. And right now, with medical misinformation being spread from the leaders of our country, it's really important for local communities to understand what the science says, whether it's about vaccines and whether they cause autism. to, right now, ProPublica ran a story this morning about measles rates skyrocketing. And this is something we covered a lot at the Washington Post too. And when you have RFK at the head of HHS, who has for years trafficked in anti-vaccine misinformation, and he's leading healthcare policy for the nation and changing vaccine schedules, is really important to highlight to your readers. If you're writing about vaccination rates falling, you should be writing also about the consequences of that and diseases like measles that were once eradicated, um, flourishing back into our lives. So it's also important when you're writing about, I'm using vaccines as an example, but the national context is important because you can point out, where things have been disproven. You should point out that, ties between vaccination and autism are false. Make sure you link to the studies in your stories. And at the same time, when we're considering the political context, um, even understanding that nothing is like completely black or white, as always. We traffic in nuance, which is what makes our jobs interesting. But there are things that RFK has said about processed foods that has shed much needed light on the harms of ultra processed foods and the impact of business on health policy. But even that has its own complications. So all of that is I'm just setting up the framing for why all of this political context is important, no matter what you're writing about. It could be about, abortion care and women's health, or, any number, fluoride in water. All of those have important national framing and political framing that should be kept at the front of mind. Um, So sorry, Chris, let me just make sure I answer your question. And what was it again?
Yeah, absolutely. No, it's super important. Everything you're saying is helpful context. So when we're talking about taking either national issues and narrowing them down for communities, or taking local issues and zooming out um, for a wider national audience, what is needed in that process for that reporting and editing? Yeah.
Yeah, so most importantly, I think talking to experts is will help ground you. There's three things you can do. One, do the reading. You can do a simple Google search and find out what's already been covered. And you can quickly, depending on how much time you have, whether you're on deadline, whether you have a week or a month, make sure you understand, the Post, the Times, the Stat News, they all cover these issues. So you can kind of understand the national landscape. But if you have time to dive more deeply, there's experts that you can call. And I can, at the end of this session, I will go to a list of experts I'll share with you. And those are the folks I normally touch base with, whether it's like think tanks or academic researchers. And the third thing is data. Data experts will totally help you frame the national context. I'm going to walk you through two ProPublica stories that I worked on last year that illustrates how the national context is important in different ways. So the first is Margaret Coker's series for The Current in Savannah, Georgia. Her project was focused on Georgia's failed Medicaid work requirement experiment. And it was the perfect timing. This was, I think, the first story that I edited when I came to ProPublica last January. Her the timing was perfect because Trump had just been elected. Georgia at the time was the only state experimenting with Medicaid work requirement. And this was something that Project 2025 was pushing. And as we all know, it's since been adopted. The nation will be taking on Medicaid work requirements starting 2027. But Margaret did a really great job. Not, I mean, she dove deep into Georgia's experiment and how it's a failure. The amount of money it cost, how much money went towards consultants, um, the fact that so few people were actually enrolled in Medicaid once the work requirements kicked in, which, some could say that was the point of a lot of the conservatives pushing this, but they're not serving the people who are most in need of Medicaid in Georgia. And to nationalize it, it wasn't even like she had to do, um, we just needed like a couple of graphs on what does this mean. One, we need to have the political context that this is something that Trump administration is pushing. And two, where else has tried it? This was being floated by a dozen other largely Republican-led states. So all of that is just simple framing to make her story um, mean more, both to the local readers, but also ProPublica's audience is national. And so we co-publish these stories with our local news partners. So it's every story that we do has that national context. And then Jessica Schreifel's story in the Salt Lake Tribune. This wasn't a year-long project. This was just about one specific Utah surgeon who had falsified COVID vaccine cards. And the Biden administration was prosecuting him, and this was dropped under the Trump administration. So that's all interesting, as a standalone story, but I was interested in what does this illustrate at large? After COVID or during COVID, there were a lot of medical professionals, and I knew this from working at the Post. One of my reporters at the time, we started a beat covering medical misinformation. So she was very much examining these issues. In fact, we linked to a lot of her stories. Um, this whole medical freedom movement and medical professionals who are using misinformation or lying about who got vaccines just to get out of, they were very anti-mandate even though the COVID vaccine was saving lives. And from it's not just about this one particular surgeon and his pardon, but what does that pardon mean? And so we made sure that her story included that context. And part of that is pointing out this is they were using medical misinformation. I think we can't ignore that part, but also how outside of the mainstream this is. There's a line in there about how the Trump administration's evisceration of longstanding federal vaccine guidelines and rejection of scientific evidence have alarmed the American Medical Association and other professional medical groups. So this is not just us casting judgment as, people like to point fingers at mainstream journalists as having particular leanings because we believe in science. But these are established medical professional groups that are calling out their colleagues for doing this. And that was a really good context, but I also feel like it was really important to have the fact that RFK has replaced members of the Federal Vaccine Advisory Panel with his own people and push the CDC to restrict access to vaccines, including COVID shots. And so all of that, I just thought this story in particular had a lot of national context. One of our research reporters, Molly Simon, worked with Jessica to review, if Moore was like an outlier or not. And we found at least 12 other healthcare professionals who were charged after giving or selling fake COVID vaccine cards. And that was just on fake COVID vaccine cards. There were other issues that we didn't really delve into in about, medical professionals trafficking misinformation. So there's a little bit of context here about where these other people were being prosecuted, California, New York, New Jersey, just to highlight that, this one guy, Dr. Moore, was not an anomaly. And we also pointed out what happened to some of those medical professionals. And another point that Jessica found that I thought was really interesting. So a lot of the political context I knew because I'd been deeply immersed in this at the Post. But she also found this group called Co-Victed Patriots on Twitter. And it was a very small group of healthcare workers who were using Dr. Moore's example as like a rallying cry to help get other people who've been charged, um, get their charges dismissed. So Jessica went and, interviewed the founder of the group and some of the other people that they knew of to just add a little bit of context. If you read the story, there's a link in the story in the slides. There are voices from a couple of other people lower down.
Great. Yeah, no, both of those super interesting, but also exactly what you're talking about in terms of um, contextualizing these national issues through this like local reporting. Um, and and so what are maybe some of the challenges, Tracy, that you could talk us through about Again, like either localizing national stories or nationalizing local stories. And how do you and the reporters overcome these through your work?
Yeah, I think mostly a lot of local reporters don't know where to start. Sometimes that people are overwhelmed, like they're so used to covering the local school board or the city council that they're not as frequently asked to nationalize stories. And when I was at the Boston Globe, I covered local schools. But I think because it was a regional paper, we did try to nationalize stories as much as possible. Also, Boston likes to think of itself as like the center of the universe or the hub of the universe. And so they think they are setting these trends. And oftentimes, when it came to education, they were. But it is really just finding experts, and we'll get to that later. But also, a big challenge too is making people care. That's not so much a nationalizing issue, but it kind of is related. Telling these sometimes wonky healthcare stories, health policy stories, making local people care, but also the national audience care. And the best way to do that is through characters, having the right people illustrate what you're talking about. So your story doesn't read like a white paper or some research paper. Like you're writing a story and you want it to be compelling. And so I'm going to talk about a couple of Washington Post stories that I was involved in editing, that really use local characters to write about a national issue. In this case, we were doing a series on life expectancy and how life expectancy in the United States was like the worst and dropping. A lot of outlets had already covered like that top line issue, but we were trying to get at why. And so what we did was use characters as well as unique data analysis to show um, a more holistic picture of what's happening. There was a series of stories. I'm only going to talk about two that I was editing. Um, One of the reasons, and I think people may or may not be surprised to hear, is, sorry, life expectancy is dropping overall because obviously, there's obesity, there's heart disease, all of those play into it. But the two stories I was particularly interested in was focusing on the role of politics in people's life expectancy and also the role of ultra processed food. So we'll talk about politics first. In this case, to illustrate a national story through a local lens, our reporters did, after talking to a bunch of experts, like when we're talking about a national issue, and we know we did unique data, Dan Keating was our data analyst. He did unique data analysis to figure out, where in the country life expectancy was dropping and also what the reasons were. Then our reporters talk to experts about where can we go that kind of strings politics together, like in terms of public policy at the local level with outcomes. And they decided, and this was their idea, on focusing on three communities along Lake Erie. And it was in three different states: Ashtabula, Ohio, Erie, Pennsylvania, and Chautauqua, New York. Um, and they use these communities to show how local political decisions on different things from seatbelt safety to smoking and smoking cigarette taxes, how all of those play a role in American life expectancy. And so their like sentence, America's problems are Ohio's problems, and in large part Ashtabula's problems are Ohio's problems, and in large part America's problems. I just thought that's like a beautiful sentence that summarizes what we're trying to do here. Um, but to tell the story, we had to set it in one of the three places. And the place that we ended up focusing on was Ashtabula. Lauren Weber, the reporter, went back several times, but the first time she went was just talking to various people that we thought could be main characters. Um, Initially, her idea was to focus on someone who died, someone whose life was cut short because of these policies. But when I read the draft, someone who's dead is not a very transformative character because they're dead. And so after talking to her, she had met the funeral director, and that guy was awesome. So she's like, I was like, the funeral director is the guy, the character that can lead us through all this. He's the guide through all of this. And so she went back and she drove around town with him, and she saw this guy wasn't ever wearing a seatbelt, and he also drove super fast. So all of these things are like like it's not like we could plan this stuff. Like these, she's driving around with him to pick up bodies, and the guy is just taking his own life at risk. So these are details that very much made this a very compelling story to read, not just like an important one that you feel like you have to read. Um, and so I won't go too much more into that, but you can read the story and you could see for yourself how compelling it is. The other story we did was slightly different. It was on Lunchables, and we wanted to talk about ultra processed foods, but we wanted it to have a business accountability angle and how corporate America and policymakers in Congress sometimes work hand in hand to shorten American lives. So that's a very strong thesis. And how do we show this? We knew that in talking to Actually, I think I don't remember how Lunchables came. Oh, we were trying to figure out what type of ultra processed food is being served in school cafeterias because everyone can identify with school cafeterias. So first we were thinking, should we tell this through the lens of milk and the types of milks being served? Because strawberry milk, chocolate milk, like a lot of that is being served, like the high sugar. But then we thought, what is more American than Lunchables? And at this time, members of Congress had actually lowered, like they changed the threshold for what could be served at, sorry, I don't know the details of it exactly because it's been a while, but there is a guideline on what can be served into schools, like the types of how much sugar, how much fat, how much sodium. There's limits on all of those. I think there was a change in those limits, but at the same time, uh, Kraft, which made Lunchables, changed the makeup of Lunchables from what they sell in stores to what they were proposing to sell in schools so that they could come into this very potentially very lucrative schools market. And not only that, they wanted schools that were serving free and reduced lunches to buy all this. So it's like your tax dollars that are going to buy these ultra processed meals for the poorest children in America who can't afford to eat. Um, so we wanted to get behind the scenes on that, but the policy was just starting. We knew that the policy had passed. We knew Kraft had re-engineered their Lunchables, but we didn't know where to go to tell it because we were waiting for schools to actually adopt this. So it wasn't, the reporter set up a Google alert on Lunchables, and there was like a tiny news release that from like Pembroke Elementary School starting to serve Lunchables that came up like sometime in the midsummer. Like we were getting worried because our series was launching in the fall and we needed a school to go to. School wasn't going to start until in the South in August and up here in September-ish. Um, so anyway, they were able to find a school, thank goodness, and go there and use that school as the center of how Lunchables came to be. But the story is much more than that school. The school was just a narrative framing for it, and the story really goes into the backdrop of how these policies and how much lobbying is at work.
Yeah, great. So many great details in all of these stories from the funeral director to really being in a cafeteria where the Lunchables are. And you're talking through all of these stories, the through line is clearly, those using those details for those national issues. And what about a local reporters grounding national issues like healthcare for their communities? So going the opposite way, if you could talk to us a little bit about that.
Yeah, so I told you earlier, I was saying we will talk about experts, and let's get at that now because I feel like um, earlier I talked about, reading broad coverage, Googling around for topics that relate to what you're writing about, focusing on experts and getting the data. And I do have a list of experts that I would love to talk through with you because this is what I did when I was both a reporter and as an editor advising um, local reporters. Um, so we can skip ahead we could just skip the Zika story because that's So these are the resources and experts that I was thinking about over the weekend on who would be useful to call. Obviously, you don't need to call um, every single person, but these are various places to start. So KFF, Kaiser Family Foundation, they are like such a great resource because not only do they do their own news coverage, but Craig Pulaski, he's been a longtime media contact there. He is so accessible. He will get back to you and he will tell you exactly who to talk to within KFF who have done original research on various topics. KFF is also who I relied on a lot when I was covering national healthcare at the at the Boston Globe. When I was a national political reporter, I was writing about healthcare from the political lens, but also traveling the country. And KFF has the whole 50 state ranking on a bunch of different issues. And so, if you're going to Mississippi, they're like the worst in so many different health metrics. Texas is the worst and so many others. I mean, you could just see where your state fits in. And that's just the easy way to nationalize, how bad things are there. Then there's different think tanks that are very, very helpful. And I put a broad political spectrum of people from the Urban Institute, AEI, which is kind of libertarian. Obviously, Heritage Foundation leans to the right, but I've found really good policy experts at all of those different think tanks. And it's important, I think, especially now, to make sure you talk to experts from a broad political spectrum because of who is in power now and who is shaping our national healthcare policy. Lobbyists are also super plugged in and really, really good sources of information, especially for data. Lobbyists for hospital associations, doctors groups, disease groups, generic drugs. There's lobbyists for everything. I'm based in Washington, so I have um, when I came down to Washington for the Boston Globe to cover politics, that's when I was able to really quickly nationalize things because like all the think tanks are based here. I used to go to coffee or lunches with all these different groups. But they are very accessible. You email them and they can either send you a policy paper if they don't have time to talk, or they can put you in direct contact with, one of their researchers. One of my best sources were legislative aid. John Kerry's health aid was fantastic. Scott Brown's, this is like old people that you may not know, but Scott Brown's a Republican, but his legislative health aid was super fantastic. They really know what's happening. They may not speak on the record, and you don't need them to speak on the record. You really just need their information, their data. They can recommend who to call. They can tell you the backstory of how certain bills are being pushed. Obviously, they have an agenda, so keep that in mind. Also with the lobbyists. But all of that is just really good context. It really helps you get up to speed quickly. Most of these people I just call on background, like I'll never quote them. And then of course there's the federal agencies, which these days is very different than the federal agencies in terms of credibility, is very different than when I was covering healthcare. But there's career staff, the ones who are left at some of the federal agencies, former career staff are very, very helpful. Former directors and the commissioners of CDC, FDA, NIH, if you're able to access them, some of them are in academia, they're very helpful. And, law firms have healthcare practices, so sometimes they're very helpful. And it just sometimes when I used to get at the Post, people are always emailing us about all sorts of different things. Like universities are saying, "Oh, we have these experts." I always file them away because you never know when you're going to need them on deadline. And I did see, in terms of the registrants for this training, there are a lot of comms folks in here, and I just want to say the best comm folks that I've worked with. They're accessible. They understand deadlines. They can quickly get you in touch with the experts and they give you the expert cell numbers. Obviously the comms folks cell numbers, but like the best ones don't need to be the go-between necessarily. They will connect the reporter with the expert directly. So those are my expert tips. Um, yeah, we can keep going.
Yeah, great. No, these are such helpful resources, I hope, for all of the journalists here. And again, we'll be sharing these slides so you have access to these links and such after this. Um, Yeah, I wanted to ask Tracy because you mentioned data a little bit earlier, and I know data is such a huge part of all of these stories that you mentioned, but anytime we're talking about public health, and how do you, both with your reporting background and as an editor, how do you approach health data and stories, and how does that change uh, based on the audience if it's local versus national?
I'm not sure if my data reporting changes because even as a local reporter, I wanted the local and national data. Sometimes depending on the community, there's not that much local data. It just depends on where you live and what the resources are. When I was talking about the experts, what you might want to do is touch base with your local medical school or school of public health, because if anyone has data on your state, if it's not like a state that's widely written about, the local researchers might actually have what you're looking for. But again, I think KFF, which keeps data of all 50 states, is a good starting point, and oftentimes they will be able to direct you to more local people who have done research.
Great. And also a reminder too, if any folks in the audience have questions, you're welcome to pop them in the chat or in our Q&A function here. But otherwise, I have plenty of questions for you as well. So, getting away a little bit from the big structure pieces of a story, let's talk about craft a little bit. Tell us how to utilize a nut graph or other structural elements within a story to help widen the scope on a story with national ties.
Yeah, so I was the worst at writing nut graphs as a reporter. It's so much easier as an editor because as a reporter, everything's important. But I mean, the point of a nut graph is really to situate your readers in why what you're writing about is important and the some of the national context. So some of the stories talked about earlier, the nationalizing graphs, not all of them, but some of them were like elements of the nut graph. Um, I also say don't stress out so much about the nut graph. That's your editor's job to talk it through with them. Like you don't have to feel like you're alone in this. But you just have to collect the goods, like do the reporting so that you all can write an authoritative nut graph. I like to write nut regions, which, is not like one graph. Maybe it's like two or three. That's kind of controversial. And yeah, you just want to give people the context of why, whether their community is an outlier or are they like at the forefront of a healthcare trend, just to give people set that up for readers locally and nationally. I think it works the same.
Great. Nut region is not a phrase that I've heard before, so thanks for
I don't know
adding
if
that
it should
to
be
the
a phrase.
vocab. That's awesome. Yeah, what about a little bit more on the editing front? What are some editing habits? You talked about the example of pushing a reporter to find a different source for the premature death story. What are some other editing kind of strategies you use that makes public health reporting stronger?
Um, I think when I first read a story, I like to just like not read it as an editor. I like to read it as a reporter and just it's hard for me. Like I should just sit on my hands and just read something straight through because then you can just quickly know when you start getting bored and or when you have questions, something doesn't quite make sense. And so those are all things that are good to take note of, something that we do at ProPublica because stories are so long here. Um, I feel like when you get a 3 to 5,000 word story, it could seem really daunting as an editor, but we started using this word called impressionistic read. And so the editor shouldn't feel like, oh man, I have to like set aside 2 hours to like edit this story. No, just sit on your hands, spend 15 minutes, like you could read that much in 15 minutes, and just think about what you think, what your first impressions are for the story, because that first gut feeling is oftentimes very valuable to a reporter for feedback. And oftentimes the national context is missing from those stories. And again, I spoke about earlier how some local reporters are uncomfortable because they don't know where to start with that. Or sometimes they think, of like what's happening in Washington as a whole different world, and that they just want to focus on this one topic of suicide or this one topic of whatever it is, healthcare topic. But everything does relate back to Washington. which that is important political context to have. So that's why I want to make sure that you all had some national think tanks and folks to call. Like for example, if you don't want to call like Chuck Schumer's office, which I understand why, because he might not be helpful to you, um, make sure you figure out who the your senator or your local congressman who's the player and who's on sitting on what committee. So you can look at the list of the folks on the healthcare committee, the help committee in the Senate and the House of Representatives, and see if there's anyone from your state or region. Call that comms person and then see if there is health legislative aid that they would be willing to put you on with as background. And because you're their local media outlet, I mean, I know there's contention in a lot of places, but if you keep calling and try to develop a relationship, sometimes it does pay off, especially if you're a beat reporter. That is a relationship that's worth cultivating. And when they're on recess and they're at home, I don't know if folks still have town halls, but it's good to show up and introduce yourself in person and go to the local offices to introduce yourself to the comms person so that they know that you actually they have experts on their staff that you care what they think. Or not care what they think, you care what you care about what they know.
Yeah, absolutely. And we've probably touched on this a bit in different ways, but specifically, you were an education reporter before covering national politics. And I did want to ask, what are some of the lessons you took away from the education beat and local reporting beat that have stayed with you throughout your career?
Yeah. I just remember when I was a local reporter, both at the Oregonian and then in Boston for the Globe, before I became a national political reporter for the Globe, I used to get so pissed off when national outlets like flew into your state or region because of some controversy. They always got it wrong. They always had some nuance that they weren't getting. And it was just really annoying because then the national outlet which shall remain unnamed, will just those are the stories that get a lot of national traction, obviously, that get on national television, etc. And so I felt like for me, when I became a national political reporter, I tried to guard against that. I know from a local reporter's perspective, I'm sure I got things wrong too, but I tried not to by not rushing and trying to just focus a lot of energy on finding local Sherpas, like local guides to the community. People who, again, every time because I was parachuting in a lot of different communities as a national reporter, and the first day I go, I always try to get either an advocate or someone who really knows a lot about the issue to just drive me around and then like talk to me about sometimes like they'll start talking about, oh yeah, this is a cancer cluster, blah blah blah, like things that um context that I want to know. It may not end up in the story, but just knowing that it's low stakes for them, they're not on the record, they can just drive me around. Sometimes I'll go on, be driven around by two different people just to see how they say things differently or how they experience things differently. And in terms of finding people to tell a story through, I always go, it's always like the local advocates or just on the ground folks who help me find the best people. And I'll like this is a weird word, audition characters. Like I'll talk to a lot of people. If I'm doing an in-depth story and following someone for months, I'm going to be, pre-interviewing a dozen or so people to figure out like the right fit. Um, I don't know if that answers that question exactly, but
No, absolutely. Yeah, yeah, just as knowing, remembering that you didn't like that when people were parachuting it, or being conscious of that in your own reporting, I think is really helpful.
it's like I'm trying to use like the local characters and the data you have as evidence and people's experiences as evidence, so your story won't be so easily dismissed by, local readers or national readers. And
Great.
also, sorry, one more thing. Um, when you're writing about people, you know, human beings are very flawed and complicated. And so I think a way to guard against people dismissing your story is to make sure you delve into that complexity and like not try to flatten people into caricatures. A story is just more believable when these complex layers come through.
Great. Yeah, and We have an audience question I want to pose to you. Story ideas. You see a lot of story ideas. What are some timely ones that you wish local or regional reporters would pitch to ProPublica specifically?
Oh my gosh, that's your job. No, one of the best parts, we literally are going through this right now where we have 3 rounds each year and we're trying to partner with newsrooms in all 50 states. And so if you go on the ProPublica website under local reporting network, you'll see which states are remaining. And for me, it's not like an idea that I feel like is missing. It's usually how you pitch it. And right now, I love reading ideas from all parts of the country. And a lot of these ideas are very similar. A lot of ideas about, bad healthcare in prisons or, bad outcomes in juvenile like facilities. But the ones that stand out have that national context. We want stories that make us at ProPublica feel like, why should we tell this particular story in your state? Like, why is your state the one that this issue should be told in and not some other state with like a bunch of wildfires? It's so knowing why your state or your community stands out. And that's, again, some of this national context. And right now, what we do is we read the applications and then oftentimes we go back to a smaller pool of ones that we're very interested in, but some of the ideas are similar still. And we ask them questions. And a lot of the questions are nationalizing that or giving us more context for that to answer that question. And so depending on how a reporter is able to do that, that helps us figure out who we might want to work with. And we also sometimes in that round, we really like a reporter, we really like their newsroom. Maybe that's not the right topic at the time, but we want to stay in touch because we come with the bias of wanting to work with you. We're not trying to weed people out forever. Like we want to talk through ideas. And so we are the senior editors at ProPublica's local reporting network. We do talk to reporters all year about fine tuning their idea. So you're welcome to reach out to us anytime. And that's part of what we do. It's part of the most enjoyable part of what we do.
Great. And we do have, a number of independent writers in our audience, and our institute serves quite a few independent writers. Do you have advice for them specifically on maybe not pitching to ProPublica, but just in general, how they can contextualize their pitches to have a successful pitch?
Yeah, that's a good question. I feel like um, because I've not been a freelance reporter, I know, but I do actually work with one right now. We liked his work so much. He was a freelancer for ProPublica that we connected him with a local outlet at the frontier to partner with us. In fact, I am lucky enough to work with him on the oil and gas project. But I think the best pitches are very concise. Like we don't want to see all the data. Like we just want to know you know it, and we want to know that you can translate it into a compelling way. And this is advice I would give anyone for your stories. It's a lot of work. It can be a lot of work, and it's important work to do all this nationalizing, contextualizing, but we don't want to read all that sausage making. Like the best advice I could give is to write authoritatively in your own voice after you've done all of the reporting. So, after you've interviewed the experts, collected data, read all the other coverage that's been out there, you should feel confident enough in harnessing all of that to translate that material to your readers so it reads like a story and not as a thesis. So that's not
Great.
particular freelance advice, it's just advice.
Anyone, great. A few more audience questions here. Renata asks, what's exciting about journalism is to see the outcome or effect of the reporting. And so for you, Tracy, what has been the most exciting or memorable positive or negative effect of a healthcare story you've worked on?
Oh, wow. That's a really good question. So at ProPublica, we really, really care about impact. Everyone cares about impact, but when we evaluate what types of projects we're going to take on, I mean, we're funding these projects for a whole year. So we want to know that there is some potential for impact. And whether it's a law changing or even just legislation being floated that, you know, maybe now's not the time yet, but eventually there will be impact as um, that as we do more stories and more momentum builds. So this is not a healthcare story, but just recently, one of my partners at KQED in San Francisco, Holly McDede has been investigating teacher sexual misconduct in schools. And the first story that we published focused on one particular teacher and what's wrong. I mean, this is again a national issue, right? Sexual misconduct happens in schools everywhere. But in California, um, when a teacher, there's a committee that decides whether to discipline a teacher, and if they don't discipline them, there's no flag in the public database. And even when there is a flag, you don't know why. So this one particular teacher was fired, but then got two more jobs afterwards, and then drew another complaint. So in terms of impact, literally like the next day, our story ran, all these parents came to the school that he was teaching at. And then the day after that, they removed him from the classroom. Um, so that was immediate impact. And then there, was legislation introduced um, about how to make this better. It remains to be seen whether that will work out, but that's a start.
Absolutely. Um, Yeah, and then from Bia we have she says, I found it hard sometimes to get the local advocates to connect me to possible story characters. Sometimes they're protective of characters and may not really understand which ones make for a good fit. How do you convey that to a, in quotes, local Sherpa, or do you simply audition for a few characters for these stories?
That's a really, really good question. I found that too, because of course they're going to be protective of people, especially vulnerable people. These are their lives. They're not used to dealing with the media. There's no reason they need to deal with the media. So what I like to do is I had this experience in Rhode Island when I was writing about people leaving prison and having a hard time, finding jobs because there are policies that prevent them from getting certain jobs that they are actually uniquely qualified for, like becoming drug and alcohol counselors. And I basically went to a bunch of different halfway houses and talked to the directors. And first by phone because I was in Washington, but then I went up there in person. And I just asked if it'd be okay for me to sit in on meetings, like totally off the record. Like, can I sit in on an AA meeting that your halfway house is holding? Or can I sit in on an advocacy meeting? They're trying to change the law, but can I sit in? And there are some people within that meeting that I would be potential characters. So the halfway house let me sit in on a bunch of, Alcoholic Anonymous meetings. They told folks who I was. I didn't have to talk to anyone who didn't want to talk to me, but anyone who did, I could explain. They let me explain what I was doing, and then I can talk to folks afterwards. But then the advocacy group was very resistant. In fact, they told me I could come, but I couldn't go to the meeting. I could just sit outside. And so that's what I did. Like, I'm gonna play by their rules. And so I got there early to make sure the person knew who I was. I sat outside and I made sure as soon as the meeting was over, I went inside so that I could introduce myself to folks before they all started leaving. And that's ultimately where I found the character that I ended up focusing on. But it's hard. It's frustrating, but it's also if you put yourself in their shoes, you understand why they're very protective of people. So just trying multiple advocates. And sometimes it's not the head, it's like someone else who works more directly with the population that you're trying to focus on. Like school counselors. I always found school counselors to be the best sources because they knew what was happening with the kids inside their schools.
Yeah, and in public health, certainly getting people to talk about sensitive medical or financial issues can maybe be a challenge. You have specific strategies there of
Yeah.
building that trust.
So what I used to do when I was popping in on communities, I would go to the FQHCs, the low income healthcare centers that are funded by the government. At first, I tried to make contact by phone with the directors to explain what I'm doing. And then a lot of them actually didn't mind me sitting. I mean, anyone can go into the lobby, right? So you can go, but then it's better if you tell them what you're doing so you're not just a random person who's you don't want to freak the patients out and make them feel like, especially nowadays when immigration status is such a big problem, um, and putting people even more at risk. You want to make sure they know who you are. You're not like a federal agent. And so just getting permission from the FQHCs to sit in the waiting rooms and introducing yourself in a way that is both transparent but non-threatening, and making sure that it's up to the person to decide whether or not they want to continue talking to you, or if they won't let you in, sometimes waiting outside.
Great. Yeah, so this is my final question for you, Tracy. If you could give each reporter here and comms professionals, everyone, a piece of advice or a couple pieces of advice for contextualizing public health stories, what would you say to them?
I think repeating what I've already said, which is, doing the work to get that information is actually not, it's the information is everywhere. So it's just setting aside time to do that. And also once you get it, just making sure you translate it and write it in your own voice. Sometimes it's literally just two sentences. And it can be fresh, some reporters like to show their work a lot, but you're doing your readers a disservice if you show all your work, um, because they'll stop reading.
Great. Well, thank you, Tracy, so much for joining us and to our audience for such thoughtful questions. Again, we'll be sharing the link to our recording soon, along with our slides and the resources shared during the session, and our takeaways as well. Today's program is part of our Public Health Reporting Fellowship, which is supported by the Common Health Coalition. The fellowship offers training and financial support for mid-career journalists to complete reporting projects focused on the intersection of public health policy and healthcare delivery. The National Press Club Journalism Institute is proud to produce programs like this at no cost to journalists across the U.S., with the mission of powering strong journalism in the public interest. If you'd like to support us in this work, we hope you'll consider making a donation today. And please spare a few minutes to fill out a survey to tell us how we did today and help us improve our programming. The link to the survey is there in the chat and will be in a follow-up email as well. Tracy, thank you so much again for all of your wonderful advice and anecdotes, and thank you all for joining us. Have a wonderful rest of your day.
Thanks.